I've just had a knee replacement and I'm trying to figure out where I should start in the Curovate app. I enter my surgery and surgery date, and Curovate puts me in a stage based on my surgery date. In this case, Curovate has started me in stage 9. I'm going to press play day 1 and take a look at the goals that are presented to me in stage 9. This seems a little too hard for what I can do right now. In addition, I'm also going to review the exercises in the morning, afternoon, and evening sessions. Based on these exercises, I can see that this is going to be too challenging for my stage of recovery. There's a simple solution. I'm going to go back to the home screen, and from there, I'm going to select past stages. In this case, I'm going to go back to stage 6 and review the goals in this stage. These goals seem closer to what I can do right now. I'm also going to take a look at the morning, the afternoon, and the evening exercises. I can see that these exercises are much closer to the things that I can do right now. So I'm going to start in stage 6, day 1, instead of stage 9.